Good morning, everyone. My name is Ramsey D'Souza, the manager of the Epidemiology and Evaluation Department here at the Windsor-Essex County Health Unit. I will be stepping in today for Dr. Ahmed to present this week's epidemiological summary. So let's begin. This graph looks at the overall cases in Ontario alongside the 7-day average in the dark blue line. While the epidemic curve in Ontario has decreased dramatically, in the past month or so it has leveled off, with a slight decrease observed in the past week or so, and that's also reflected in our 7-day average. Comparing this to what we're seeing locally here in Windsor-Essex, we are seeing similar trends to what is also observed in the province. Our cases has generally stayed the same since the end of the second wave. However, in the past week, we have seen some small increases where we are seeing about 30 or more cases a day. Our current 7-day moving average has also increased from last week. This time last week, it was at 20.6 cases per day, and this is now at 30.4 cases per day. Comparing our 7-day averages in Ontario, found in the dark blue line, to Windsor-Essex, which is the dark blue. Sorry for the confusion, and Ontario, which is the green line, we see that in September and mid-November, cases grew at a faster rate in Ontario, but starting in December, cases in Windsor-Essex grew dramatically as well. Since the middle of January, we have seen that both sets of cases in Ontario and Windsor-Essex have passed a peak and have decreased. Since the middle of February, both sets of cases have also leveled off, showing generally neither an increase nor a decrease until this past week. Looking at our cumulative cases and deaths, while our deaths have decreased dramatically, our cases have not flattened as quickly as we would have liked since the end of the second wave. As mentioned in our last slide, our deaths have slowed down dramatically, and we are reporting less and less deaths day over day. This slide captures the week-over-week incidence per 100,000 population from week 18, which began on April 27, 2020, to our current completed week, which is week 9. Our most recent completed week's rate is 43.8 cases per 100,000 population. This is a decrease from last week, which was at 54.1 cases per 100,000 population. Now, looking at the most recent 7 days, which includes bits of this week and last week, our rate is 54.8 cases per 100,000 population. This is an observed increase from last week, where we were at 47.8 cases per 100,000 population. Looking at our weekly rates found in the dark blue, in comparison to the southwest of Ontario and all of Ontario, our rates are generally on par with all of Ontario at the moment, which can be found in the orange line, but is generally still higher than the other regions in the southwest, which is the green line. Looking at our wastewater surveillance data, the red line, in the past week, while low, we did see an increase towards the end of this most recent week. We will continue to monitor the trend to see which direction it goes over the next week or so. Just a quick disclaimer that the RT-qPCR method for analysis of wastewater samples is still currently under development and is being validated through this pilot study conducted in collaboration with the University of Windsor, municipalities, and the ministry. As such, the results presented here are considered to be preliminary and are subject to change. Moving on to our tests, this figure looks at all of our tests and unique individuals tested by week in Windsor-Essex. In total, since the beginning of the pandemic, 288,015 tests were completed as of March 6th. This is a complete week ending on Saturday. For the week ending on March 6th, our percent positivity was 2.4%. Last week, approximately 7,595 tests were completed. Now, comparing our percent positivity to other regions in Ontario using the 7-day average, when we look at the most recent 7 days worth of results, knowing that they are preliminary and subject to change, Windsor-Essex has the 8th highest percent positivity in Ontario, sitting at 2.4%. This has decreased ever so slightly from last week where we were at 2.5%. When breaking down a percent positivity by age group, all of the age groups are relatively low in terms of percent positivity. However, we are seeing a slight increase in the 18 to 34 age group at the moment. This group, observed in the green line, has a percent positivity in the most recent week of just above 4%. Now, when we focus on those below the age of 18, this slide looks at the breakdown of those that are school age, so from 4 to 17 years of age. We see that overall, percent positivity continues to decline across most of the school age groups, except for those in the 14 to 17 age group, which is the orange line observed here, where it is trending in the opposite direction. This graph looks at the epidemic curve among school-aged children. Our current 7-day average is 5 cases per day, which is almost 2 times higher compared to last week, where we were at 2.6 cases per day. The last time we were here was on January 27th, and prior to that, in late November, when our school cases dramatically increased. Comparing our school age cases using the 7-day average to our overall cases using the 7-day average, the difference is trending upwards for our school-aged children compared to the overall cases observed in Windsor-Essex. Our overall cumulative case count also shows a general flattening, which is similar to what we are seeing across all cases in our region, where the flattening has slowed down in the past week or so. When we look at it at our test results, this graph looks at the percentage of test results of all test results that are available within 1 day and 2 days of someone getting tested, using a 7-day average. Approximately 55% of tests are being processed with results available within 1 day of being tested. Within 2 days of someone being tested, 91% of test results are being processed and available. When we compare ourselves to other health units using the 7-day average, we are once again in the bottom half of the province. Looking to see how long it takes to get a test result to come back for when a person gets tested in Windsor-Essex, it currently takes 1.5 days, which is a slight improvement from what we observed last week, when it was taking us approximately 1.7 days for someone to receive a test result back. Compared to last week, Windsor-Essex now has the third highest rate in the province, overall average. This is lower compared to what we're seeing in Peel and Toronto. Toronto has now overtaken us, though our cumulative rates are still higher than what we're seeing in all of Ontario. When looking at our rates per 100,000 by municipality, for all of our cases, Kingsville and Leamington have the highest rates in Windsor-Essex, followed by the city of Windsor. When we look at our case rates from March onwards, Essex stands out as having the highest rate currently, followed by Windsor and then Tecumseh. When we strictly look at our cases and how they're distributed by municipality, overall 55% of our cases come from Windsor, 17% from Leamington, and 9% from Kingsville. When we look at the last 30 days from February 9th to March 10th, 70% of our cases were from Windsor, and 7% were from Leamington, and 5% from Tecumseh. Looking at the past 7 days tells us a different story. 61% of our cases are from Windsor, 8% from Tecumseh, and another 8% from Essex. Here we look at the overall cases by age and sex distribution, and then what it looks like compared to the past 2 weeks. Looking overall and at the past 2 weeks, our cases are roughly distributed in the same pattern by age group. However, we are seeing higher cases in the past 2 weeks among those in the 0 to 19 years of age, which is something we explained earlier or observed earlier among our school age cases. This slide looks at our non-epidemiologically linked cases. In simpler terms, looking at our cases acquired in the community where there are no known source of exposure. Currently, using a 7-day average, we see that about 15% of our cases do not know how they acquired the virus. Please note that the numbers presented in the past 3 or 4 days are preliminary and are subject to change based on further investigations done by our case investigators. Looking at acquisition from the beginning of January to now, modes do vary from close contact to community acquisition, but there are very few travel-related cases overall. Zooming into our cases from February onwards, and we see that our cases are acquiring the virus through close contact, household contacts in the community, and some from existing outbreaks. Once again, very few cases are being acquired via travel. This figure looks at where our cases from March have acquired COVID-19 by municipality. It looks at the proportion of cases by municipality, and here presented is that breakdown. In Amherstburg, 29% of the cases since the beginning of March acquired the virus from a close contact, and another 29% acquired it from the community. In Essex, 43% acquired the virus from a household contact. In Kingsville, 33% acquired the virus from the household contact. In Lakeshore, 33% of individuals acquired the virus from the community. In LaSalle, it was 36% who acquired the virus from a household contact. In Leamington, 33% of the cases acquired the virus from the household contact. At Tecumseh, 36% of the cases acquired the virus from the community. And lastly, in Windsor, 30% of the cases acquired the virus from a household contact. As of March 11th, we have 15 active outbreaks that the health unit is currently following. This has increased from last week where we were at 12 active outbreaks. Once again, this follows the general pattern in terms of what we're seeing with our cases as well. While cases have leveled off, we have seen an increase in the past week or so. Now moving towards what we're seeing in our hospitals. This figure looks at COVID-19 hospitalizations and patients in the ICU on any given day. It can include both new patients and existing patients with COVID-19. Acute inpatient hospitalizations have decreased again this past week and is also reflected in our 7-day average. However, COVID-19 cases in the ICU stabilized with neither an increase or decrease observed in the past 7 days. Looking at new cases admitted to the hospitals with COVID-19, we are seeing similar levels of new admissions to what was observed last week, where neither an increase or decrease was observed. Switching gears a little bit and looking at our hospital occupancy rates for all causes. In the past week, our acute care occupancy is hovering around the 90% mark and follows the same trend as to what we're seeing for most parts of 2021. After seeing periods of low occupancy in late January and early February, we are now once again seeing higher rates of occupancy in the ICU. Focusing just on the vented ICU beds, occupancy has decreased, meaning there are more free beds available. So where are we with all of our cases thus far? Approximately 95% of our cases have resolved. Approximately 1.3% are currently self-isolating. 0.6% are unknown, and unfortunately we've lost 3.0% of our cases to COVID-19. This figure looks at our deaths from the beginning of the pandemic onwards. We went through more than a month without a death from COVID-19 in October to the middle of November. Our deaths as of right now are decreasing, though our cases have generally leveled off with a slight increase observed in the past week or so. Breaking down our deaths by age and gender, we see that more females have died with COVID-19 compared to males. And also looking at the age distribution, 63% of the deaths were in individuals who were 80 years or older. The youngest person who died was a man in his 20s. Our overall case fatality rate is 3%, which is higher than what is observed in Ontario at the moment, which sits at 2.3%. Our deaths have been higher in our long-term care and retirement homes compared to our community and our overall rates. And once again, in comparison to the province, the provincial case fatality rate is much higher in the long-term care homes compared to the overall rate as well. Revisiting our doubling time, and we see that as a country, province, and locally, our numbers are approximately the same. We have decreased this past week, but in comparison to Ontario and Canada, those numbers have stabilized. The most recent estimated median R0 is 1.3. This is an increase from last week, which was at 0.73. When the R0 is greater than 1, each existing infection causes more than one new infection. If higher, it means that our case counts are increasing. In summary, the case rate in Windsor-Essex was lower last week, though in the most recent 7 days it has increased. Acquisition source is distributed between close contacts, whether it's household or someone from not in your household, and community transmission. COVID-19 related hospitalizations and ICU admissions have leveled off. The number of active outbreaks has increased, though generally it has also remains stabilized in a sense compared to last week. Our doubling time in Windsor-Essex has decreased from last week, though we are now on par with Ontario and the rest of Canada. When looking at our monitoring indicators for Windsor-Essex, when looking at our most recent completed week, our our weekly case rate is 43.8 cases per 100,000 population. When we just look at the most recent 7 days, which includes parts of this week and last week, our case rate is 54.8 cases per 100,000 population. Our percent positivity, looking at the most completed week or in the most recent 7 days, sits at 2.4%, whereas our median R not effective is 1.3. This still, we're still in the criteria for red for some indicators, whereas other indicators may also see us in the orange category as well. Thank you so much for your time, and have a great day.